You can get them, but they don't get covered if you're not a diabetic. But they're so valuable in inducing lifestyle choices, because what have my patients have found is that they have found that they can eat blueberries with their oatmeal in the morning. But if they add cinnamon, that sugar spikes goes down. If they walk for 20 minutes after, that sugar spike goes down. So it motivates them to do more with lifestyle based on the same food that they're eating. Maybe I can't have my potato for lunch, but if I have it at night, it doesn't do as badly for my sugar. So those kind of things are what you get from wearable devices that is unique to your own body. And I love that because it's that constant feedback, which allows for change to happen within you that you can sustain. So remember, it's not only what you eat, it's when you eat that matters, right? So there's the whole concept of fasting. And again, nothing is the same for everyone. So please talk to your physicians about if your fasting program is right for you. I do a lot with fasting, but I personalize it to each patient. So most people can fast for 12 hours. There's different types of fasting. There's one called time restricted feeds, which is 12 hours a day should work for most people. What does that look like? Well, I eat my dinner at 7 and I don't eat again till 7 a.m. And that works for most people. There are some people with sugar issues and diabetes and sleep issues that need a handful of a snack like nuts before bedtime. And again, everything is really based on what your individual body needs are. So time restricted feeds, I will have people work up to 16 hours of fasting. There's a whole section on, if you should work out before and all that stuff. We're not going to get into all that, but fasting is an incredible tool for balance. It changes our gut microbiome for the better. It lowers our inflammation. It can change our insulin resistance. So it can also reset our stem cells or our immune cells. So periodic fasting for 2 or 3 days a week can reset. It can get people into ketosis, which is great for our brain. It also can help us retrain our gut microbiome. And actually creates resilience. It creates resilience for us to be able to handle the same stress. So I do encourage people to use different types of fasting regimens. There's also one called fasting mimicking diets, which is from a company called Prolon. They have a very good website, lots of literature on their website for reducing cholesterol and lowering inflammation and reducing insulin, and also lowering something called IGF-1, which has been implicated in certain cancers. This is not for everyone. Again, this is it's a 5-day, you eat for 5 days of what's in those boxes. So those boxes will have, they'll have nuts and seeds, they'll have crackers, they'll have soups, they have teas, they have olives. They're gluten-free, dairy-free, but they have beans and legumes in them. So that what you see in the box is all you can eat for that day. First day is 1,100 calories, and every subsequent day is 800 calories. So it's a concept of really trying to get people to use different regimens of fasting. You're still eating. It's mimicking a water fast. When people have done studies for water fasting for 5 days, meaning all they do is water, their immune system changes at the end of it. So that is a totally different way to look at the immune system and modulate the immune system. So a great intervention, when it works great. You have to do it periodically during the year. And I could answer questions about it later, but it's another tool that is very effective in my practice. I just wanted to put this slide real quick on the shockers of how much sugar, added sugar, is very inflammatory, really signals a lot of badness in our bodies, can actually induce joint pain. Not only does it do the normal things we think about, which is, it makes me gain weight and it makes me get diabetes and sugar dysregulation, but above that, it can affect the way our brains think. It can affect the way our joints behave. It can affect overall body inflammation just with these sugars. So just shockingly how high some of these things are. And again, the goal for added sugar for most people is less than 5 grams per day. Okay. Here we talked about that. This is a lot. So I can go into more questions about, how people change their diet if we need to, but I'm going to try to get the rest of this stuff in because it's not just about food. It's also about, there's so many other lifestyle that we can do. And sitting is the new smoking, right? So we can It is just as bad for us to sit most of the day than it is as it is to be smoking in terms of its cardiovascular risk and its overall risk for dying. So we know that people who are mostly sitting have a higher fall rate even for people as they age. So it's not just about dying, it's also about losing your independence. And there are some new recommendations out there. Basically, we're trying to shoot for, there's a lot of words on this slide, but at the end of the day, 45 to 90 minutes a day is what's recommended to either moderate or intense physical activity. But the issue for this is really just do something, even if for someone who sat all day long and they walked for 10 minutes, that will help them with their health. That will lower risk for cardiovascular disease. So bottom line is sit less, move more. It doesn't have to be that you go to the gym. Maybe you can't walk to your mailbox today, but you try to get to your mailbox. Maybe at the end of the week, you try to get down your street. Maybe you just stand up between your meetings. But whatever it is, it's sit less. Okay. So I don't want people to be overwhelmed with the numbers here because it can be overwhelming, but it translates into about 45 to 90 minutes a day. But again, doing something is better than nothing. And there's lots of benefits with exercise. It helps with heart disease. It helps lower blood pressure, helps with weight management. It helps build muscle. It also lowers what's called one of the markers that I use for the blood called fibrinogen. It lowers fibrinogen levels as we exercise because exercise is anti-inflammatory. It decreases certain cancer rates like colon cancer, and it increases muscle mass. And when it increases muscle mass, it can improve your mental health. This is really powerful. It improves memory. It can improve our resilience to stress. So my actual stress response to the same exact sympathetic hit that I'm having can be very different in terms of its tax on my parasympathetic system if I have more muscle mass and if I exercise. Why? Because our brain has more endorphins. Our brain has more serotonin, which is our happy juice, and it does better in terms of our perception of stress when we exercise. So the inflammation from that stress that is hitting my brain that translates to my body is less because I exercise. So the same life situation can result in many different inflammatory responses in the body if we add more muscle and movement and start to work on just balance and strength, things like that. One of my favorite things to share for most people who don't have to go to a gym, just as a morning stretch, a morning routine, is called sun salutations. And the reason I love this is because most of the day, as I'm doing now, I'm sitting. I try in my practice to sit on a ball or to do a standing desk, and I mostly walk around. But a lot of days where I'm on Zoom calls, I'm sitting. And so I try to do sun salutations or some of these poses in between patients sometimes because it works the back of my body, it works the extensor muscles, which can be very, very helpful. And if the stretching, the things that it does are the sun salutations. If you go through the whole thing, you can do it in 1 minute, 2 minutes. You can take 10 minutes, depending on how slow or fast you do this. But it works all my extensor muscles, which are asleep when I'm sitting. So as we wake up these muscle groups, we are less inflamed. As we wake up these muscle groups, we are less depressed. So we want to work on moving and stretching, and everything works. Even stretching has been shown to help with longevity. So, think about adding something even as a yoga stretch in between. Favorite home yoga person is Yoga with Adrienne. She's got wonderful tapes, videos online on YouTube, and she has something for everyone. Chair yoga for those people who have lots of knee issues. She has something for everyone. She has a detox yoga. She has a sleep yoga. She has a breath yoga. I mean, it's just wonderful. So please look at that. And like I said, there's other options if you're someone who has to do meetings all day, sit, stand, desk, exercise ball, take the stairs, park farther away, do things that make you sit less. If you're at your child's soccer game, don't sit, walk around, enjoy nature, do things that if we look for it, we will find ways not to sit. We just have to find those ways. This is one of my favorite poses between patients is because it wakes me up. It actually wakes me up. So my brain gets perfused. If I'm feeling sluggish or tired, I will do a down dog and it'll wake me up. But at the end of the day, you don't have to do anything. Make it fun. Just because I do yoga doesn't mean you have to do yoga. Find something, dancing with your grandchild, throwing a ball to your dog, whatever it is, just find an activity that will make you be passionate about movement. Okay. So think about what I said about the timings, but also just start with things you love and things that make you feel good. Okay, so the other big intervention, this comes to, we talked about the digest part of the parasympathetic. Now we're getting into the rest part of the parasympathetic. The rest part is sleep, and I obsess about sleep. Sleep is hugely, hugely important. And it is one of the first things we throw out the window when we're stressed. I do it too. It's like, well, I'll sleep later. I don't have time to sleep. I got to get all this done. But it is so restorative, and it actually makes us more efficient in the next day. We do better at our tasks. We crave less sugar. Make better food choices. We also have the energy to move more when we sleep well, right? And we also don't react to things as adversely when we're well rested. So restorative sleep looks like 7 to 9 hours, and it definitely has a benefit in cardiovascular health. It helps mobilize fat. It helps our hormones. It lowers our hunger hormones. It helps our satiety hormones. Another big area in my practice I focus on is detoxification, and sleep is where we detoxify our body. The cells in our brain, from all the reactions that it's doing all day, are actually cleaning house at night. The brain cells actually shrink, and there's fluid around that actually drains all of those chemical reactions and makes room again. It's kind of like decluttering your house. You have room to breathe, you have room to move, you have room to function better when the clutter is gone. And that's what we do in sleep. We declutter, we detoxify, we need to get the junk out. So not sleeping, we were walking around a little bit more toxic. We were walking around with a little bit more cortisol. We also heal in sleep. So our injuries, we grow in our sleep. So, adolescents with all this, stuff out there for them, not sleeping, it's affecting their growth hormone. It's affecting their memory. It's affecting their mental health, which is why some of the schools, including my neighborhood, has changed the start timing for their high schools, because they've seen that, it has helped with mental health, and it'll help them perform better in school if they sleep better. So don't underestimate sleep. Sleep deprivation has a direct link to obesity. Also, probably part of the problem in childhood obesity going up, because when we are sleep deprived, we increase our hunger. Our leptin goes down, which is just a satiety hormone. Our ghrelin goes up, makes us hungrier. We increase calorie intake. It leads to fat deposition. It also allows us for more hours. When I tell you, don't eat for 12 hours, but I'm awake till 2 o'clock in the morning. What am I supposed to do? And your brain says, I'm really tired. What do you want to do? I'm going to go eat some sugar. That's kind of our reflex mechanism. So when you next time get that signal of, I want to eat sugar at 10 p.m. at night, think about maybe that you're too tired and you just need to go to sleep. It alters our metabolism. It also increases our fatigue, which over time reduces energy expenditure, also leading to weight gain. And obesity has been linked to so many medical problems. And that's one of the reasons why those GLP-1 agonists are making such huge headways in lowering cardiovascular risk now, because when people lose weight, they're lowering their overall mortality and cardiovascular disease rates when they lose weight. So that is really important to consider. So please prioritize your sleep. Start removing your notifications. Start, removing caffeine in the afternoon. So there's this counterproductive thing that happens when we're very stressed out. We actually don't metabolize the coffee very well. So imagine this. You're so tired. You slept 5 hours. You have a cup of coffee in the morning. It wakes you up. By noon, you're tired again. And so you have another cup of coffee. And by 4, you have another cup of coffee. By 10 o'clock that night, which would be the solution for why you're so tired, is that you slept so late or you didn't sleep enough. You can't sleep because all that caffeine is now keeping you awake. And we have different metabolism of caffeine. Some of us are fast metabolizers, some of us are slow. I have patients who can have an espresso shot before they sleep, doesn't affect them at all. In other people with the slow metabolizers like me, if I have anything in the afternoon, it'll keep me awake. So everybody's an individual. So listen to your body and figure out if caffeine isn't a problem for you. Stopping electronics. The glasses to block blue light is a little bit controversial, so I'm not sure that's as effective. But maybe create some sort of sleep routine for yourself, reading books instead of your tablet. Watch TV, but maybe not watch things that are upsetting, like the news. I mean, I find that the biggest horror show on TV is the news. And so it's very disturbing to fall asleep with all this negative concepts in our brain. So try to read something or do something that's pleasant and avoid LED lights in the bedroom because LED lights tell our melatonin in our brain, which is our sleep hormone, to activate. So you basically have less ability to fall asleep if your melatonin is low. Okay, so this is part of, oh goodness, I have to go a little bit faster because I want time for questions. So this is one of my favorite parts of the lecture because I am obsessed with stress and I'm obsessed with our thoughts because I have found through my own life experience that if I think differently, if I've changed my attitude towards being more of an optimist, to being calmer, to do the things that kind of make me less reactive during the day, my body does better. I'm able to lose weight. My sports performance goes up. I sleep better. So many things do better. So these are all the techniques I usually spend a lot of time talking about. I'm throwing this on there because cortisol is so important. Cortisol, our stress, our worry, our fear response directly impacts our body, inflames our body. So do the things that help you sleep better. So simple things like 4-7-8 breathing. So if you breathe in for 4, you hold for 7 and exhale for 8. That just activated my parasympathetic system. That lowered my cortisol. If I do that 5 times in a row, it makes me feel better. If you do that multiple times during the day, fantastic. So these are tips that you can do because your breath is always with you, right? We have all heard someone say something to us or someone say something to someone else. If you are stressed, breathe. What does that even mean? Well, when you exhale longer than you inhale, you activate your parasympathetic, you activate your vagus nerve. There's exercises called yoga for the brain. It activates your right and left hemisphere because you hold on to your right and left ear and you basically squat on the inhale and exhale on the uptick. So you're going down and up. And I do this when I'm doing a live lecture, so I apologize, but yoga for the brain is really restorative. It helps everyone kind of wake up. It's 15 ups and downs and that's it. But you're holding on to the right and left side of your ear, so it activates both sides of your brain, and it's very restorative. There's lots of organizations that teach people how to do meditations, the mindfulness-based stress reductions, transcendental medicine, transcendental meditations, art of living. They're all organizations that teach people how to breathe and meditate. There's apps on your phone, Insight Timer, Calm, Headspace. Walk in nature, take your shoes off, go outside every day, get the sun. Simple things you can do to try to activate your vagus nerve and lower your cortisol. There's also sounds. This is actually phenomenal. There's sounds that you can get on places like Spotify, where you put one pod in or one earphone here and another one here, and there's different frequencies in binaural beats. They're different frequencies. That's why they're called binaural. They negate each other, and they can calm your brain down. They can give you the frequencies where you are in sleep mode. They can give you the frequency of concentration. So they're an effective tool, simple, that you could do at home to help you concentrate better or help you fall asleep. So check that out too. Okay, so quick talk about vagus tone. I can spend a whole lecture on vagal nerve too. Gargling activates the vagus nerve. Why is the vagus nerve important? Because it activates the parasympathetic, it activates our rest and digest, it charges our battery. Singing in the shower, humming, chanting. When you sing, I'm not talking about, low sound singing. I'm talking about singing like you would in a church, really loud and kind of vibrate and, sing to the point where you're just almost like euphoric. That's the level of sound of singing. So I apologize if there's other people, if you're not a good singer like me. I'd only do it in the shower because I don't want to hurt anyone's ears, but that level of singing does activate the vagal tone. And breath work, and then cold therapy. That's a new one that I've been starting to do, cold immersion, and I can spend more time on that if people have more questions on that. And I want to end with our outlook. There's significant amount of literature coming on how our optimism or our outlook helps us age better, helps us recover from illness, decreases our ability to get illness. It helps modulate the stress response. It helps us choose healthier habits, but 11 to 15% longer lives. So if that was someone who was going to live to 80, they could potentially live another 10 years till 90 because their outlook is, I have more hope. Tomorrow will be a better day. This too shall pass. Strong interpersonal relationships and improved inflammatory markers have all been shown to be associated with just a better outlook. Well, how do you get that? Well, there's work in all of this. I personally was not an optimist at birth. There is a genetic predisposition for optimism. It's only 40%. So 60% of that you can change based on working on things with meditation, with exercise, with journaling. Um, One of the best things I ever saw that kind of changed my practice on optimism was Sean Akers' TED Talk. It's on YouTube, and it talks about how you can start to create more happiness in your brain, and you can do things in 5 minutes every day. And that involves gratitude. That involves journaling something good that's happened to you, not a bad journal. There's a role for journaling negative things, but there's also a role for positive journaling. And along with exercise and meditation is random acts of kindness. So doing something, even a smile, when you smile at someone, when you do something for the person in front of you at a Starbucks line, you pay for their, in back of you in a Starbucks line, you pay for their coffee. Small things do lots for good for our body. So look at that. Positive emotions also flood the brain with dopamine and serotonin, which are happy juice. They're motivating us, they're keeping us happy, they're keeping us less depressed. They improve our mood, they improve our learning, they improve creativity, they increase memory. So positive emotions, joy, curiosity, euphoria, things that are happy, pleasant, are things that we evolve to. And that's when you start cultivating a practice like what Sean Aker talks about. Okay, so I've discussed a lot of things. There's a lot to do. There's plant-based, there's fasting, there's optimism, there's sleep. There's so many things. Where do I start? This is where I go back to, what is your why? What was the reason you wanted to listen to this lecture? What is it that you're worried about? Are you tired? Are you finding that you are maybe not as active? Start with one thing. And maybe that one thing is, I'm going to go out for a 10-minute walk today. It's nice and sunny. I'm going to take my shoes off and walk in the grass. I'm going to try to look up a meditation app and see if maybe that's something I can do to help my sleep at night. Everyone's path is going to be different. This is why personalized medicine is so important. Things that work for one person doesn't work for everyone. And maybe you start with just eating more fruits or vegetables, or maybe you start with adding more spices. So start with one thing, and you will be amazed, because just as one thing starts to make us spiral downward, one's positive intervention will build on more positive interventions. And pretty soon you'll find you're in a different place, and you'll want to convert everybody to your lifestyle pathway. And it's not always a home run, right? So you want to work with your physician. There are things that are out of our control. There are things that this won't fix completely. So you still want to work with a provider. You still may need medications. You still may need surgery. It's not the end all be all, but it's definitely worth a great effort and an intention. With that, I think I will end. And if you want more information, it's Body on Fire book, and I will start to answer questions, because I think I went over a little bit.
Yeah, no worries. Thank you so much for that very thorough presentation. So we're going to begin the Q&A portion of our session.
Did I turn off my screen then?
Yeah, you can go ahead and shut off the share. All right, perfect. Yeah, so thank you again. It was extremely thorough. So so we're going to begin the Q&A. For people who want to ask a question, you can raise your hand in chat. If you don't know how to do that, we'll put the instructions in the chat. So your style or modality of treatment is obviously very drastic than the mainstream treatment. How do your patients respond? I'm sure many of them seek you out, but do you get patients that are just coming to you as a regular doctor and then are surprised by your method of treatment?
So about 12 years ago, I changed my practice. Initially, when I tried to do this on my traditional practice, when I had 10 minutes a patient, I would basically blurb out one intervention like I did today at the end of our talk. Try to go off gluten. Try to do this, and I'll see you next time. And I found that even that one little intervention made such a big impact. It was really interesting to me that, just giving them a meditation app and helping them sleep a little better. I found this out when I was an acupuncturist and I started doing acupuncture and I was treating someone's carpal tunnel, and they told me that their gut was better. And I was just like, that's crazy. What does that have to do with carpal tunnel? And I started understanding that the whole body's connected through this autonomic nervous system, and all of these things are connected. So yeah, I always, most of the time I start with diet. To be honest, because that has made the biggest difference for people. Within 4 weeks, they come back and they feel something better. Like my joints don't hurt as much and my sinuses are clearing up, or something's getting better. And I think what people need is to get the buy-in, because this is like first time they've heard this from a doctor. This doesn't make any sense. What do you mean you're not giving me a medicine? What do you mean this diet? What does that have to do with my pain? And so I usually throw a diet out or food plan out for each person based on what they're coming in for. And I have a follow-up usually in 4 weeks, and most people, 80% are somewhat changing. They're not completely cured, but they're getting better enough to buy into it, and they'll start to do more.
Great, thank you. And how do other doctors respond to your modality?
That's really fun. It's definitely getting more acceptance. When I first left my other practice that was more traditional, people thought I retired from medicine because they thought I was going to just tell people to meditate all day and, do acupuncture on them and not do traditional medicine. But to me, this lifestyle component, it actually is the real medicine. And so I have found that some people think they don't know that I'm still practicing internal medicine. They think I've retired. But I have been getting more referrals from other providers, including cardiologists, to say, I don't know what you did with my last patient, but they're much better, and I need you to do whatever with this person. So I think there's more buy-in. There's people seeing success. I've lectured to the American College of Cardiology about this, and so there's more acceptance on the role of these interventions as opposed to traditional medications and surgeries.
Thank you. Yeah, because we had Dr. Kim Williams on the other day, who was
Yeah.
the former president. So I'm sure he's helped kind of.
Oh, yeah. I mean, totally. There's definitely a mind shift change in the last 10 years.
And have you gotten any negative pushback from from the industry? Obviously, you've got a pharmaceutical industry whose business model is sell pills and whatever their medications are. Has there been any pushback from that? Given that I imagine your modality doesn't sell as many pills.
There's been one interaction I've had with another provider that called me about a patient, because when I see someone who's not in danger and they have hyperlipidemia or high triglyceridemia, I will tell them that I want to show you what power you have. I'm not putting you on a medicine right now because within the next 3 months, I think you'll be safe, but you will need to do this so that you know what power you have. And I won't put them on a medicine. And I got kind of scolded by another physician saying, what are you doing? Why are you not treating this person for X, Y, or Z? Because they're at danger of having a heart attack or a stroke. And I basically responded with, I know that, but they're not in danger right now. But there is this opportunity for them to realize how powerful their lifestyle choices are. And I don't want them eating their steak and just taking a statin. I want them to understand that there's power and they'll feel better, because the medicine only can do one intervention. It's not going to actually give them energy or help them sleep better as lifestyle can do. So I did get some pushback with that. I occasionally get the pushback from a drug like Ozempic, where they come and tell me that obesity is a chronic medical problem. The patient should be on it for the rest of their life. I don't believe that to be true. I believe that to be a segue, or something that is a bridge for someone to initiate lifestyle, to make them feel better, to give them more energy. And some people need to stay on the medicine for the rest of their life, but most people can make these changes and kind of settle in a new baseline that's not needing medications, or dose changes can also happen. So maybe they can't get off the med, but the dose can change.
What are the first signs of chronic inflammation people should look out for?
So I had spoken about that in one of the slides, about it can actually look like anything. And for me, it looked like a ton of fatigue and tiredness in the afternoon. But weight gain is a big one. Weight gain. Why am I gaining weight? Why can't I lose weight? That is a big one that tells you your body's out of balance. Why am I so tired? Why do my joints hurt? My back's starting to hurt. I'm feeling so old. That's what a lot of people say. I can't do as much as I used to in a day. I can't remember things. Why am I forgetting things? My job. I have some people come in and say, my job's at risk because I can't perform my duties. All of these itises of different organs. Even I'm getting sick so many times is telling me that their immune system is off, right? So almost any symptom, hair loss, anything that people get is a symptom of an imbalance. So I would say just kind of really pay attention to what itises are showing up. Some people come in and they're just like, I don't know why I'm so anxious. I'm anxious all the time. That's an itis of the brain. So it really depends on any organ that can become inflamed and give you a symptom.
So you mentioned hair loss. What would be potential causes for someone who's losing, like clumps of hair or it's
Yeah.
coming out? It's one thing as you're getting older, especially males where they get the traditional pattern of baldness, but it's another thing when your hair's coming out, a little bit
Yeah.
more fast. What would
The
be some of
most the
that?
most common reason I see for hair loss is high cortisol, high stress. That happened a lot during COVID. The loneliness of COVID, the fear of COVID, the fear of the vaccination. There were so many reasons people were so stressed out during COVID, and a lot of hair loss. And cortisol causes hair loss. Cortisol, elevations of cortisol. Low progesterone can cause hair loss. So when people go through perimenopause or menopause, when women have premenstrual issues, vitamin D deficiency, iron deficiency, B vitamin deficiency, lysine deficiency, which is a protein deficiency. So when you think about deficiencies, I think about the gut. Is your gut absorbing things? Is your microbiome okay? Is there a gut brain inflammation? What's going on that's making your scalp inflamed? Because that is a symptom of inflammation.
Great. And what tests would you suggest people get to make sure that they're in the right balance of health?
So, along with the symptoms and their overall energy, just a height weight ratio. If you have, your height and your waist should be about half of your height in centimeters. That's a ideal body weight because as we gain inflammation in our body and as we accumulate what's called visceral fat, our midsection starts to grow. And so that becomes an endocrine organ. It releases a lot of inflammation and it releases a lot of problems in terms of other organs. So it sends signals to other organs to get inflamed. So just a waist circumference is one thing. Obviously, blood pressure. A BMI is a reasonable tool. It's not the end all be all. That's a height weight ratio, and it comes up with the number, whether you are normal weight, overweight, or obese. But that's not the end answer because thin people can have inflammation and overweight people can have high muscle mass. So it's not the end all be all, but it is one tool and a marker. So if you have that information, it's helpful. Then in the blood, I like to do CRP, which is a marker of inflammation. I like to do an expanded lipid panel. Everybody gets a fasting insulin and a hemoglobin A1C, which are markers for sugar control. Even if you don't have a history of diabetes, even if you don't have a family history of diabetes, we catch a lot of prediabetes. And the whole thing is about being proactive and understanding what your inflammation is about. We do markers for genetic predispositions for heart disease called ApoB and ApoE. We look at LP little a, which is a marker for increasing plaque promotion. I'm looking at urine for just function of the kidney and nutrients. So everybody gets vitamin D, B12, folate, zinc levels, iron levels because they do a lot. And in my plant-based community, they do have deficiencies in some of these, and we have to supplement. But a lot of people have deficiencies, not just plant-based people. Red blood cell count, kidney liver tests.